Hello everyone, now let us discuss about part 4 of antiarrhythmic drugs. In the current session, we will be discussing about class 4 of antiarrhythmic drugs, which are nothing but calcium channel blockers. So the class 4 agents, they mainly act by blocking the voltage sensitive calcium channels. And the antiarrhythmic drugs of class 4, they mainly act on L type of calcium channels. To be more specific, the antiarrhythmic drugs, they act on L type of calcium channels. Class 4 of antiarrhythmic drugs, they act on L type of calcium channels. And the drugs that we are going to discuss in the current session are Verapamil and Diltiazem. These two are the calcium channel blockers which are used as antiarrhythmic drugs. Coming to the general mechanism of class 4 antiarrhythmic drugs, they usually act by slowing the conduction in SA and AV node, and this results in the slowing of the conduction. It is mainly contributed by propagation of action potential, which depends on the inward calcium current, and because they block the calcium channels, they slow the conduction in SA and AV nodes. This results in slowing of heart rate and terminating the supraventricular tachycardias by causing partial AV block. And additionally, they shorten the plateau of the action potential. Class 4 drugs, they act on the plateau phase. They shorten the plateau of the action potential and reduce the force of contraction. And this decreased calcium entry reduces the after depolarizations, thus suppresses the premature ectopic groups or ectopic beats. And this is the overall antiarrhythmic mechanism of calcium channel blockers. They mainly act by slowing the conduction in SA and AV nodes. This results in the slowing of heart rate and termination of supraventricular tachycardia. In addition, they shorten the plateau phase of the action potential, which reduces the force of contraction. And this decreased calcium entry reduces after depolarizations, and thus it suppresses the premature ectopic beats. Now let us discuss about the first drug, that is Verapamil. It blocks the L type of calcium channels and delays their recovery. It mainly acts by suppressing the calcium mediated depolarization, and this suppresses the automaticity and re-entry dependent on slow channel response. And the Verapamil is more likely to act in partially depolarized fibers. And one more important point is phase 4 depolarization in SA node is reduced. Verapamil reduces the phase 4 depolarization in SA node, resulting in bradycardia. Bradycardia is an adverse effect of Verapamil. This results because Verapamil reduces the phase 4 depolarization in the SC node. And the reflex sympathetic stimulation due to vasodilation, it partly counteracts the bradycardia effect. And one more important point is delayed after depolarizations. DAD, delayed after depolarizations in Purkinje fibers are also dampened. And prolongation of AV nodal effective refractive period occurs, which results in the markedly slowed AV conduction, and re-entry involved AV node is terminated. One more important effect of Verapamil is it has negative ionotropic effect due to the interaction or due to the interference with calcium mediated excitation and contraction coupling in the myocardium. This may precipitate failure in damaged hearts. Hence, it is contraindicated in congestive heart failure and in partial AV block. It is given orally. The IV injections are also available, but they are dangerous and almost never needed. It has a plasma half-life of 6 to 8 hours and undergoes extensive first-pass metabolism and more marked for isomer that is responsible for cardiac effects. The first-pass metabolism is more marked for the isomer of Verapamil, which is responsible for its cardiac effects. Slow release preparations are also available, but they are less effective owing to their metabolism in the liver. Coming to the adverse effects, In addition to the general adverse effects, that is bradycardia and hypotension, verapamil may cause constipation because of its effect on the calcium channels in GI nerves and smooth muscle. And the risk of causing cardiac failure and heart block are also associated with verapamil. Hence, it is contraindicated in these conditions. Coming to the drug interactions and contraindications of verapamil. If verapamil is added to digoxin patients with poorly controlled atrial fibrillation, the dose of digoxin should be reduced and the plasma concentrations of digoxin should be checked after every few days, as verapamil disposes digoxin from its tissue binding sites and it also reduces its renal clearance, predisposing to digoxin accumulation and toxicity. Hence, it is contraindicated, or care must be taken whenever digoxin and verapamil are given simultaneously. And verapamil is contraindicated in patients with Wolff-Parkinson-White syndrome, which is a pre-excitation syndrome caused by a rapid conducting pathway between atria and ventricles, which is anatomically distinct from the physiological conducting pathway. This WPW, Wolff-Parkinson-White syndrome, predisposes to reentrant tachycardia, and verapamil is contraindicated in this syndrome, and it is also ineffective and dangerous in ventricular dysrhythmias because it can convert an IV dose of verapamil may convert ventricular tachycardia to ventricular fibrillation. Hence, it is ineffective and dangerous in treating ventricular arrhythmias. It is also contraindicated in partial heart block and sick sinus. Coming to the uses of verapamil, it is mainly used to treat paroxysmal supraventricular tachycardia, PSVT. It can prevent the attacks of PSVT. A simple dose of 5 mg of IV over 2 to 3 minutes is effective in 80% cases. But the IV verapamil carries a risk of marked bradycardia, AV block, and cardiac arrest and hypotension. For that reason, it should not be used if PSVT is accompanied with hypotension or congestive heart failure, and also for patients who are receiving beta blockers. And for preventing recurrences of PSVT, verapamil 60 to 120 mg targeted drug delivery system may be given orally, which is effective. The next use is atrial fibrillation. It is used to control the ventricular rate in the atrial fibrillation. 40 to 120 mg of targeted drug delivery system, oral targeted drug delivery system can be used or can cause a dose-dependent reduction in the ventricular rate, and it is a first line of drug for this purpose. Verapamil is the first line of drug to control the ventricular rate in atrial fibrillation. It is inadequate response, digoxin may be added to the therapy. It can also be injected intravenously for emergency control of ventricular rate in atrial fibrillation. Coming to the next drug, that is Diltiazem. The cardiac actions are similar to that of verapamil, but bradycardia and depression of contractility are less marked in Diltiazem. And Diltiazem is an alternative to verapamil for termination as well as prophylaxis of PSVT. In addition, for immediate or instant or rapid control of ventricular rate in atrial fibrillation, Diltiazem is preferred over verapamil because it targets the heart rate, preferential targeting of heart rate, and causes less hypotension and myocardial depression. Since Diltiazem causes less hypotension and myocardial depression, it can be used even in the presence of mild to moderate congestive heart failure. By this, we complete class 4 of antiarrhythmic drugs, which are calcium channel blockers. Thank you for watching. Please subscribe for further videos on pharmacology.